final speaker for the panel is Chris Power, who is the President and CEO of Capital Health Authority in Halifax. Chris.
Well, thanks so much, Andre, and I'm really delighted to be here today to share with you a program that is happening at Capital Health in Halifax. I could have chosen a number of them, but this is one that is near and dear to my heart, and I think really speaks to what we're trying to address here at this conference around efficiency, patient and family-centeredness, and appropriateness of care. So this particular program is called PATH, which is a Palliative and Therapeutic Harmonization. It was, I wish I could take credit for it, but it was developed by two wonderful geriatricians that I have the privilege to work with at Capital Health, Dr. Paige Morehouse and Dr. Laurie Mallory. And they went down this path because what they were seeing in their practice was frail elderly arriving in their clinics, most of the people with some form of dementia, and understanding that the healthcare system had just simply not been set up to manage these people and to help them navigate through the system. So, you know, what are the cold hard facts that are staring us all in the face? This is no news to anybody, but we know that older adults are the fastest growing segment of our population. And, you know, good for us that we're living longer, and the advances of medicine have enabled us to do that. But what we all are seeing, no matter where we are in the healthcare continuum, we are seeing people who are living longer with multiple chronic diseases, many of them very frail elderly, very vulnerable. And yet, the way that our healthcare system is structured, it simply does not meet the needs of these patients. If we think of clinical pathways, if we think of a lot of the research that's being done, much of that happens without the frail elderly as part of that population. Yet these are the people who we often, who are utilizing our healthcare system in significant ways, who are frequently in our emergency departments and our family physicians' offices. We have this dangerous cycle that's really threatening the sustainability of healthcare when we look at our frail elderly. And, you know, it truly is this cycle. So we have the frail elderly, they enter our healthcare facilities, we don't manage them in a way that's about their everything that's wrong with them. Most of the people who are involved in this work are on at least 9 medications, if you think about that. We do not care for them in the most appropriate way. We send them to, whether it's a nursing home or back home, they get into a healthcare crisis and the situation continues. So what's truly driving this for us? Well, certainly medical advances are a big issue, so people are living longer, but not necessarily more healthily. We have a real failure in our system to coordinate complex care. So we still look at people as disease entities or organs of care rather than looking at the whole person and looking at them through a lens of frailty. We are treating one thing at a time, and we have an epidemic of assessments. So I don't know in your organization if any of you have managed to go to one assessment tool, but if you have, I would bet that each individual healthcare practitioner is still filling out their portion, rather than one person, us trusting that information, and one person filling it out and looking at the patient as a whole. So these two geriatricians decided that they needed to create something very different. They needed to create a model of care where teams came together and really were very collaborative. So one person filled out an assessment form. The team trusted the information. They came together to look at the wholeness of the patient, always with frailty as the lens. So there's lots of evidence out there that suggests to us that when we put people in hospital, we do interventions for them, we do surgery on them, if they have dementia, we are making it worse for them. Yet we continue to do that. They wanted to create a system where patients and families felt empowered by the information that they were providing for them to make the right decisions, because what they were seeing is that patients, and when patients were unable to make those decisions because of their level of dementia, their substitute decision makers simply did not have the information in front of them to make good, informed decisions about quality of life and what the impact of this would have on their loved ones. This was creating a model that optimally used resources. because we know that we do things to people that cause harm. We know that we do things to people that are not necessary and don't. So lots of times we do. We're doing great things, but many times we don't. And so this was about, if we don't have more resources, how do we use the resources in front of us in the most optimal way? And it was helping people navigate through the healthcare system, because what was being found with the frail elderly is they truly were having difficulty navigating through, no matter where they were on that continuum of care. This is a really busy slide, and I know it'd be difficult for many of you to see, but it really just outlines for you what some of the programs are. This started as the 2 geriatricians in their clinic, meeting with patients and families and developing this whole process or method of care, but we've since spread our wings and have moved in a number of directions. So we have a pre-surgical path, primarily dealing with cardiac surgery patients. So the cardiac surgeons recognizing that they needed to do something very differently because our cardiovascular ICUs were jammed with patients who weren't going anywhere because decisions had been made to do cardiac surgery that weren't perhaps in the best interest of the patients. We have a renal path program for people who are facing dialysis and needing all the information that they didn't have before about whether this is the best choice for them, and we've got some good data to support people making different decisions than they would have they not been involved in this program. A path for long-term care and one for continuing care. There is a whole education program that goes along with this. It's a 2 or 3 day education program for teams on how to talk with patients, how to provide them with the correct information. And we're seeing spread in Ontario. A number of places have invited our teams to come and teach them about this, and throughout Nova Scotia. There are training manuals, there's information for patients, and I invite you to go on the website that you may or may not be able to see that on the bottom. It's simply pathclinic.ca, where there is an enormous amount of information about the program, resources there for you to use. I do want to just say that this program came about through an innovation fund that we had in our organization a few years ago. We took money out of our operating account, set aside $2 million to help seed great innovative ideas that our teams were bringing forward. And so this particular program is not resource intensive. What that seed money did was help them to develop their website, to develop the tools, to develop the assessment tool, but we do all this work within existing resources. We've just simply shifted them. This is the approach in a nutshell. It's 3 visits for the patients and families. The first is really understanding the whole person in front of us, getting their picture. The second visit comes and the geriatrician or whoever the team member is meeting with the patient talks to them about what it is to be frail, to be a frail elderly, what it is about having dementia, how that impacts on the decisions that you're going to make going through the healthcare continuum. And often we see patients and families being quite upset and angry at this particular point. Number one, because nobody's talked to them about that before. They haven't really understood what the impact is. And understanding that this is a terminal illness and that they need to make some decisions that perhaps were different before. And the third visit is really empowering them, helping them have the toolkit in their pockets for whatever healthcare professional they come up against in the future or interact with in the future, to ask them, to ask the right questions about the impact of their dementia or their frailty on whatever decisions are being put in front of them. So just quickly, some of the outcomes that we have seen. We have had many more patients through this, through the PATH program in our organization and beyond, but we did an outcome study just on the first 150 who had been through, and as you can see, 71 of those patients were scheduled at the time of their initial visit with the PATH program for 77 different surgeries or interventions. And once they were through that program, 75% of them either canceled their surgeries or their interventions when they recognized what the impact would be on themselves or their loved ones. 10% of them required hospitalization and made different decisions when we surrounded them with care in the community to live with dignity and making the right decisions. And we have very high patient and family satisfaction. It's amazing to see and to hear see the letters and hear what people have to say. This just gives you an idea of where that's happening. We've had over 22 people decide not to go through dialysis, since we've started that just about 9 months ago. That may not seem like large numbers, but think of how we replicate that and continue this program. This is huge when you think about the resources that people are using in our healthcare system. So this really is, we believe, can be transformational. It is all about sustainability and appropriateness. It is about better care using less resources. It truly is for these patients and their families. It's about shifting the services that we have and shifting the resources, not adding more to our system. So a better use of what we have. And it is just about educating our health professionals to change where we're going. I will tell you that if you sit in an auditorium full of surgical residents and surgeons when one of these geriatricians is doing grand rounds, it is amazing to watch the transformation that happens. They will start with a vignette of a patient who requires surgery, a frail elderly, but going through all of the things that are wrong with them, and she'll ask, how many people here would do surgery on this patient? And almost every person puts up their hand because they think they can fix that organ that they're going in after. When she talks about frailty and really educates people on what happens to you when you enter hospital, what the impact will be on your dementia and your frailty if you go through this surgical procedure intervention, she asks at the end, how many of you would do surgery on this patient? And although there are always one or two who are going in no matter what, the vast majority of them do not put up their hands, and you can just see the transformation happening in their faces to say, I didn't know. Last week, we had 3 patients who were in the hospital ready to go to surgery, had been fasting, were in our preoperative area going, who our geriatricians received consults on when the surgeon or the anesthetist saw them and said, you know, they remembered the grand rounds. The geriatricians went and talked with the patients, talked with their families and walked through, and those patients left the hospital that day without their surgery because they made decisions about what the impact would be if they went ahead on this. So for me, this is transformational work. I'm so proud of this team, as you can probably tell. This has wonderful applicability across all of our healthcare system, wherever we're dealing with people who are faced with a terminal illness, but particularly our dementia and frail elderly people who none of us care for in the most appropriate way, not because we don't want to, but often because we don't know. So I'm going to stop there and invite you really to go on the website. You'll learn a great deal, and hopefully you can utilize it in your organization. Thank you.